Good day, everyone. Visual diagnosis, an inspection of facial complexion. Inspection of facial complexion means to inspect and examine the color and sheen of facial skin in order to understand the condition of chi, blood, and Zang-organs. Introduction. The facial color, the color of the skin. Skin color is associated with blood and yin. Color on the face can directly reflect the ebb and flow of the blood and the condition of the blood circulation. Under pathological circumstances, it can reflect the different characteristics of some organs and their pathological changes. And facial sheen, the luster of the skin luster is associated with qi and yang. Luster is the exterior manifestation of the essence qi of the organs. Theories of facial complexion diagnosis. The heart dominates the blood vessels. Its luster is reflect on the face. The divine pivot states that the qi and the blood of the 12 primary channels and the 365 connections ascends to the face. All 6 yang channels rise up to the face, especially the foot yangling stomach channel. Therefore, there are abundant channels and blood vessels on the face. Thus, facial colors not only manifest the heart condition but also the function of all other organs. Facial color is derived from yin, blood, and facial luster from the spirit. Complexion is the outward manifestation of the condition of the 5 organs. This is the physiology of normal facial complexion. The yin and the blood generate the facial color. The essence, yin and qi form the spirit manifest in the luster. This is the normal facial complexion. The correspondence of portion of face with Zang-fu organ. Each of the Zang-fu organs has a corresponding location on the face. Observation of the facial complexion should be integrated with the inspection of localized facial regions. There are 2 different arrangements. One according to the basic questions and the other according to divine pivot. You can see in this slide the portion of the face corresponding to the Zang organs according to basic questions. The left and the divine pivot is in the right. So as you can see, normal facial complexion. Normal facial complexion refers to the facial color and luster of a person in a healthy physical condition. Because of different genetic pools, facial color and skin color have many variations. Bright, moist, and lustrous. The indication is qi and blood are sufficient and the functional activities of the Zang organs are in good condition. And the clinical manifestation and physiological variation, the color and the texture of the complexion can vary in accordance with the different constitution, geographic environment, season, weather, and profession. Normal facial color can be classified as follows. Host or governing color. The normal facial skin color of one's race, it remains unchanged during life. Guest or visitor color, the slight change of facial skin color which follows seasonal changes. In terms of season, the origin, spring is in the channel, summer collateral, the late summer is the muscle, autumn is the skin, winter is the representation of marrow. And the seasons in the complexion, the spring is the blue-green, in the summer is the red, the color is red, late summer is yellow, autumn is white or pale, and the winter is black or dark. That is the guest complexion. Transient normal complexion, changes in the complexion due to different working conditions, climate, living environments, diet, sexual activity, and emotion. This is the normal complexion and its manifestation. The normal complexion, the common features include brightness and the luster. The host complexion, guest complexion, transient, and normal complexion. In the host complexion, the color from time of birth. The guest complexion, seasonal changes in the color. And the transient color complexion is the temporary changes in color and sheen due to environmental and physical or emotional activities. Clinical significance of inspection of complexion. Observation of the complexion will help the practitioner to recognize the location of pathological change and judge the condition of pathogenic and antipathogenic qi. Also differentiate the thermal nature of the pathological change. Identify the organs and channels involved. And also make a prognosis. Method of facial complexion diagnosis. Number 6. In order for the practitioner to obtain the most accurate data from the patient, one must pay attention to the following variables. For one, time. Early in the morning is the best, or at the time after the patient has calmed down. In terms of environment, quiet and without stimulation. In terms of light, it is the best for it's the natural light. Clinical manifestation of pathological facial complexion. The facial complexion of the sick person, it may be said to include all the abnormal colors as well as the pathological brightness and sheen. Scope of the abnormal facial complexion. Abnormal facial complexion includes abnormal facial color and sheen. Single color dominates in different races. Facial color and skin have many variations. Although in general, the normal facial color should be harmonized mixture of the 5 different colors. When a single color dominates, it indicates a pathological change. Letter B, obvious exposure of color. Normal facial color should be subtle and gentle. A sharply contrasting color on the skin indicates a disorder of the qi, blood, or Zang-organs. Color changes are inconsistent with changes in the season. Facial color should change slightly following the changes of seasons. Color changes inconsistent with the season indicate pathology. Letter B, the abnormal facial sheen. Whether and deemed is a pathological change of the facial sheen. This indicates deficiency or failure of the essence qi. This is the illustration of the scope of abnormal facial complexions. As you can see, abnormal facial complexion is composed of abnormal facial color, abnormal facial sheen. And the single color dominates, sharply contrasting color, and the color disagrees with the season. Pathological facial complexion and indication. The 5 colors and their associated diseases. Letter A, the blue-green is ascribed to wood. It governs in spring, is the color of wind. It is related to the liver and gall bladder organs. The blue-green complexion, distinguishing features is, in the blue-green, the indication is wind. Dark blue-green, the indication is cold. Sudden appearance blue-green, pain. Blue-green purple, the indication is stasis. And the pathogenesis of this different indication is blood doesn't fill up the vessels which are naturally blue-green in the face due to obstruction or construction of the blood vessels. Letter B, red is ascribed to fire. It governs in summer, is the color of heat, and is related to the heart and small intestine organs. This is the table of red facial color in indication. Distinguishing features, red over entire face. The indication is excess heat. Distinguishing features of red cheeks, deficiency heat. Superficial zygomatic flush with the pale face beneath. The indication is this is protein young. And the pathogenesis is this is heat accelerates the flow of blood and fills vessels leading to the appearance of the red color. Letter C, yellow is ascribed to earth. It burns in late summer. It's the color of dampness and it's related to the spleen and stomach organs. You can see this is the table yellow complexion. The distinguishing features is bright orange yellow, and the indication is jaundice, and the jaundice is two type, the yang type and the yin type. And the pathogenesis is damp heat obstructs and steams the bile to the surface. Also, smoke hazy yellow. The dim luster yellow, the indication is dampness. Dull pale color yellow, cold damp in the middle burner. Pale color yellow, the indication is spleen chi deficiency. Puppy pale color yellow, the indication is spleen chi deficiency with water accumulation. And the pathogenesis of this four indication is dampness accumulates, which limits spleen transportation function, leading to a lack of blood rising to the face, a slightly pale or yellow color ensues. The third D, the white or pale is ascribed to metal. It governs in autumn, is the color of dryness and is related to the lung and large intestine organs. The distinguishing feature of pale blue-green, the indication is cold. And the pathogenesis is cold contracts blood vessels which prevents color from appearing on face. The pale white, the indication is Qi deficiency. The bright white, the indication is Yang deficiency. Pale white and weathered yellow, the indication is blood deficiency. Pale white without sheen, the indication is bleeding. And the pathogenesis of these four indication is Qi or blood deficiency gives rise to a loss of nourishment of the face which causes the pale color. Letter E, the black or dark is ascribed to water. It governs in winter, is the color of cold and is related to the kidney and bladder organs. Dark facial color is indication. Distinguishing features, dark black, indication of internal cold, kidney yang deficiency. Dry scorched black, the indication of kidney yin deficiency. Black eye socket, swollen lower eyelid, the indication of phlegm damp. The purple black indicates the blood stasis. And the pathogenesis is the channels and blood vessels spasm and contra causing the blood to stagnate and thus darken. Letter B of abnormal color. When pathological color manifests on the face, besides differences in color, there are also differences in such qualities as location, brightness, thickness, and concentration. In quality, the location is deep, floating. The description is color hidden inside skin and the color visible superficially. The indication is internal pattern and external pattern. In brightness, bright and dull. The description is color is clear and distinct and color is dark and dim. The one with the clear and distinct is the yang pattern and the color in the dark and dim, it is the yin pattern. Thickness, thin and thick. The description of this colors is shallow and light. The indication of this is Qi deficiency. The description is color is deep and thick, and the indication is excess pattern. The concentration, scattered and concentrated. The description is color is dispersed or scanty, And the indication of this is new or mild diseases. In description of accumulated color, the indication is injury or serious disease. Letter C, abnormal sheen, clinical manifestation, whether dim, lusterless, and dry. The indication is exhaustion of essence, loss of spirit, imminent death, and poor prognosis. And this is the summary of inspection of facial complexion that we discussed. Thank you for your attention and have a good day.